Melissa, there we go. Perfect. Thank you. So again, good afternoon, everyone, especially those that were just joining us. My name is Shamia or Mia. I am the Interim Viral Hepatitis Program Director with the state of Tennessee or Tennessee Department of Health, and I will be the facilitator for this session. Next slide. So today's agenda is going to include some introductions and announcements, just general information, a didactic presentation on building patient trust by Dr. Allen, and then 2 pediatric case presentations, and then some closing remarks as well. Next slide. Perfect. And so starting with some in-chat introductions, before we get started, if you'll just take a second to introduce yourself and in the chat and include your name, your role, your organization, and whether or not this is your first ECHO session. And yes, thankfully, Anastasia is able to help with technical issues, such as changing your name in Zoom so we can see who you are as well. And so this is a good time. I think we might have maybe one other person that is still on a phone. So whoever you are with your phone number, it's a 615 phone number ending in 915. Do you want to come off of mute and share your name if you're able to? Okay. We can always try and circle back or connect with you afterwards. And you can always email us at echo.tn@tn.gov to make sure that you're connected with us. So next slide. A few quick reminders. I do want to highlight, the requirement to go ahead and make sure that you have signed up for this session. And Clover was kind enough to drop the registration link right there in the chat for us, or you can scan the QR code, either one. But this is going to be what's needed for continuing education credits as well, and it helps us know that you are here. Go ahead, next slide. Please go ahead and turn on your video if you haven't already. We always like to be able to see who we're talking to. I do see several faces already, so that is great. And feel free to take yourself off of mute to ask questions, but otherwise keep yourself on mute while others are speaking. Next slide. A couple last quick reminders to never discuss PHI and please treat everyone with respect. So with that, we will pass it off to Dr. Allen to get us started with our didactic this morning.
All right, thanks for that introduction, Mia. So today we will be talking about building trust between provider and patient. Now we'll specifically be wanting to look at hepatitis C patients, but this can be all-inclusive for other patient populations as well as you handle them in your primary care setting. Next slide. I do not have any conflicts of interest to disclose with this presentation. Next slide. Now, as far as our objectives, we want to make sure that we define what trust is. We want to make sure we're looking at current trends and current levels of trust in the healthcare system, whether it be the healthcare system itself or providers itself. And we'll look at that in just a bit. We want to be able to describe key components of how to build trust. We want to make sure we're looking to implement certain methods of how we interview patients, motivational interviewing techniques. We'll discuss those. And then our final topic will be explain the truth and then let the patient decide. Let them make that final choice. And we'll talk about how to get to that point throughout this session. Next slide. So we first want to start off by defining what is trust. I looked at a couple different definitions and I picked out some of the ones that I like the best. The first one, assured reliance on character, ability, or strength of someone or something. So we want to make sure we're building trust between our patients by having a good interaction with those patients. I like the last definition as well, the activity of developing a bond between people so they can work together effectively. And I believe that's very important, is that we are working together with our patients for a common goal. We want to educate them. That way they're educated and know more about their health diseases or health conditions. That way they're empowered to know how to tackle them and take care of them themselves. So we want to make sure we're talking to them appropriately and on their level to make sure they're aware and understand their health conditions, and therefore they're able to take it from there and kind of be the champion of their own health. Next question. Next slide. So we'll first want to look at a survey that was done in the United States. This is after COVID. I want to make sure I found a study that was after COVID. So this will be from December 2020 to February 2021. Next slide. This survey was performed by the National Opinion Research Center at the University of Chicago. It's a large independent social research organization in the United States. And what they looked at, they wanted to see what the current rates of trust was, but now after COVID happened, and if there was any changes. So they wanted to look to see if COVID, the pandemic, changed any perceptions of how they viewed the healthcare system. And what they found is that the trust in clinicians was actually greater than the health system as a whole. So it's very interesting. They wanted to dig down into that further. It did show that a majority of patients had the same level of trust with the healthcare system as it was before and after the pandemic, but there was a 32% decrease in the trust in the healthcare system as a whole for patients. So most patients did feel the same about the healthcare system, but there was a 32% decrease. So that was kind of alarming that there's that many people that had lost trust in the healthcare system. In that same breath, we wanted to look at physicians or providers specifically, and it showed that most patients did not feel that there was a change in their trust level pre-pandemic and post-pandemic. That 77% of patients felt the same trust, but there was a 12% decrease in some patients' trust in their providers after post-pandemic. Next slide. So I want to drill down into what was kind of the drivers of some distrust that was to kind of boiled up potentially with our providers. We wanted to look at the main ones of what their responses were. They felt that the provider spent too little time with the patient. They did not listen to them. So that kind of goes back to making sure that I know all providers have busy workloads, but spending the right amount of time without spending too much time, so that way you're not kind of prohibiting your time with your next patient. So finding that sweet spot is very important, making sure that you hear your patients, understand them. That goes along with listening to their complaints, knowing them, understanding them, because you wanted to build that relationship. You want to know where they're coming from. You want to understand their social aspects, kind of all those things kind of go into their health as well. And we want to make sure we're providing the best health care plan that we can for that patient. So making sure that we're following these things, giving them all the information they need. So these are things that the patients felt that they weren't getting from their providers, and therefore that caused a decrease in trust. I was kind of concerned that there was a 25% other. I would really like to drill down into what other aspects there were. As far as I could tell on the survey, they did not post out what other was. So that was a big chunk, and I'd really like to know what other factors could have been contributing to this. Next slide. And then we'll go to the next slide. So now we're going to look at ways to build trust. So there's going to be a couple different graphics here. They're all from different resources, and I kind of wanted to just puzzle piece them together and show you different ways of how different governing bodies kind of looked at how they should build trust. So this is from the American Board of Internal Medicine. They first wanted to start out with communication. It is the most important thing with our patients. We want to make sure we talk to them effectively and appropriately on their level so they understand their health care. We want to make sure we show them respect and humanize them by make sure we're spending enough time with them and not treating them like a number. I feel like that's very important to not feel like the patient is rushed through the patient visit. We want to make sure we're doing all that we can to explain their disease states, making sure that they are making decisions for their own health care and not just feel like we're forcing things. And that will come later on. Caring and comfort kind of go hand in hand. We want to make sure we're showing compassion and empathy for the patient. The old saying goes, the patient doesn't care how much you know until they know how much you care. I feel like that always will bode true, that we want to make sure we show them compassion, that we want to help them increase their health and make their lives better and increase their quality of life. Those are all important things, especially in the hepatitis C population. I get a lot of phone calls that they will kind of be down on themselves and just feel like there's no hope because they know how expensive the medication is. But once I'm able to kind of talk to them and explain and be transparent and just tell them all the facts, it makes it more achievable of a goal. And I feel like that's very important about making things goal-oriented. We'll talk about that in just a bit. Competency plays a role as well. So knowing your disease state, knowing kind of the process, kind of being able to communicate that to the patient is very important. So being well researched in your field, being very experienced, goes a long way of understanding pitfalls, where they might appear, and how to tackle those with the patient as they come about. And then cost is another major component of building trust. Now, there is a cost, of course, of the lab visit, of the clinic visit, of the medication. So we want to make sure that we're being transparent about those potential costs. One, most of it's going to go to insurance plan, but we want to make sure we're being aware of them to let them know of potential charges. Maybe with copays, I try to always make sure I tell my patients that my goal, depending on what insurance plan, I can either get it to $0 or a $5 copay, depending on it. So I want to be upfront and forward about knowing what the medication costs them. Don't have as much experience about the lab orders or the lab expenses, so I try to tell them that as well, that there may be a charge associated with it, like a copay for the visit itself. I don't have all the information on that, but I do want to let them know that just what to expect. I can mainly speak to the pharmacy aspect, so I try to let them know that even though the medication is $15,000, maybe $25,000, that I'm going to make sure that their insurance company does cover it, and if there's a copay, that I'm going to work and do my best to get it to a $5 or maybe even $0 copay. But this is more from a kind of a website that was not really looking at anything in the medical field. This is more just building trust from a psychological aspect. So here's like a couple different tips and tricks of how you might build trust. Being consistent, being true to your word, that kind of just, that's kind of straightforward. Just wanted to make sure that what you say you're going to do as far as helping them with their medical care, that you're able to follow through with that. Communicating effectively, just make sure you're straight to the point, being upfront with them, letting them know about the risk involved with your disease state and what we can do from a hepatitis C standpoint to cure the hepatitis C. So there's always an easy goal for hepatitis C. Other disease states, there's different goals in mind, but for hepatitis C, the main goal is to treat and cure it. Now, as far as building trust gradually, making decisions carefully, that I will speak more to that kind of goes for internal medicine or primary care. I don't have that luxury of building trust gradually because usually I see patients, they're coming to me specifically for hepatitis C treatment. I don't have as much a longer timeline to build trust gradually. I kind of have to lay it all out in the beginning and try to build trust as much as possible to hopefully ensure them that understand their disease state. I understand where they're coming from. I want to listen to where they're at as far as social factors and do my best to make sure I can meet their needs, get them treated for hepatitis C, and then they're moving on without it. And that's kind of how I try to phrase it. So I have a more limited timeline than some of the primary care doctors. Being honest and admitting mistakes. I feel like that's very important, especially if something happens in the process where maybe medication wasn't sent or the PA wasn't approved or was denied, and that information is not being explained to the patient. I feel like sometimes I'm working too much behind the scenes, but I'm not communicating all of that information to the patient, and I find myself leaving them in the dark. They get a denial level fact or mail to their house, and then all of a sudden they think they're not going to get the medication. But in the meantime, I've already changed the medication, got it approved for a different medication. And that's just something that I need to make sure I'm always telling them each step, knowing that it's still under control, even if something gets denied, just always making sure that you're communicating with them and being honest to let them know that everything's still working out. And as far as showing feelings, doing the right thing, that always is appropriate for all your patients, letting them know that you're a human being too. You're not a robot, just like they're not a robot. You want to make sure you treat them as a person and always listen to what their desires are for the treatment, and respect that as well, doing what's right for the patient. Next slide. And as far as these are tactics that I like to implement for my initial setting. So motivational interviewing. So this is something that we want to make sure we're utilizing. It's a brief counseling technique that can be effectively used to help patients overcome reluctance and make behavioral changes. This is more in line with talking with patients about substance abuse, which we'll talk about in several weeks from now, but it can also be used to get the patient talking, understand kind of what their situation is, if there's insurance issues, if there's social factors, kind of meet them where they're at but you got to get them talking. You got to ask open-ended questions to get them talking, because the goal is you want them to have a behavioral change to want to treat the hepatitis C and worry about it, and hopefully get away from potential substance abuse history if that's in their past as well, trying to get away from those things, because they would be at risk of getting reinfected with hepatitis C if they were to continue in practicing substance abuse. So making sure that if we're going to have changes, make sure that they originate with the patient. That's kind of the main thing to note. And then we want to make sure we're talking about small goals. So I mentioned that a while ago earlier about setting goals. We don't want to always set unattainable goals. Now, for hepatitis C, there's mainly going to be one goal of treating hepatitis C and cure it. But there's also potential other social factors that could come into play. Some patients might have alcohol issues, and we want to talk about that. I've talked to a patient recently that wanted to just stop cold turkey, and they said that they drank a lot of alcohol. They wouldn't tell me exactly, but I just said, let's not go cold turkey and go all out. Let's just cut back. Let's just reduce in half or more than half, trying to just get them a more attainable goal, because we know that there's negative consequences of if you were to stop cold turkey drinking a lot of alcohol like that. So making sure we're setting small goals, appropriate goals that we know they can meet. And of course, you want to encourage those patients when we meet those goals along the way, let them know that we accomplished that goal. Now what's next? What's the next goal? And just kind of make it kind of easier to chew on instead of taking one big giant leap of a goal at one time. We always want to make sure we're listening reflectively and listening attentively to the patient. We want to make sure we're not just checking boxes by asking all our specific questions. We want to make sure we're listening and modifying, engaging our patient based on how they respond. We don't want to just check all our boxes and then we're done, because the patient will pick up on if we're just answering the same questions and we're not responding to anything they're saying, then they know that we're kind of not really engaged in the conversation. So we want to make sure we even flow with the conversation, how it goes, making sure we're listening to them, answering follow-up questions that they might have about certain aspects. So listening attentively goes a long way to making sure that they know you're engaged, as well as keeping them engaged. And of course, at the end, you want to make sure you're summarizing everything that they say, making sure you interpreted what they said in the correct manner. That way we can make sure we're all on the same page about what is the goal and what we're going forward, what the plan is as most important. Slides okay?
I think that we might have lost our slides here for a second.
Okay, that's fine.
Are we able to reload them? Unless I got kicked off. Clover, are you able to make it so I can share my screen? Let me see if I can share them.
Yeah. Let me see.
I might be sharing it. Did it work?
Yeah, I think your screen's up, but I went and made you co-host too. So
Okay, let me try to put it in a presenter view so it looks nicer. Do you all see the slides?
Yeah,
Awesome.
good.
Okay, now let me just scroll forward. Don't mind the dizzy moment here for just a second. Okay, I think we were finishing up here. Sorry about that. Go ahead.
Yeah, we were making sure that we summarize what the patient has said to make sure we interpret what was said by the patient and make sure everybody's on the same page. That was kind of the last point. So just hearing them out is most important. All right, next slide. And now we're rounding third, heading for home. So this is our last one. I thought this was a very interesting article that was published about tell the truth and let them choose. So the most important thing is, of course, still at the top, communication, making sure we're developing that bond through appropriate communication, talking to the patient on their level, not using a bunch of medical jargon that they're not going to understand. We want to make sure that they understand it on their level to make sure that we're both on the same page. Now, as far as providing truthful information, very important. We want to make sure we're upfront with them about the disease state, what risks there are, and what the outcomes are as to why we want to treat them. So I tell patients that we want to treat their hepatitis C because we want to stop further liver injury. We're trying to prevent liver cirrhosis. We're trying to prevent liver cancer. So I want to tell them things on the front because I want them to know there's a reason why I care so much about treating hepatitis C. So I tell them truthful information. I'm not trying to scare them. I'm just trying to be upfront about telling them information about their disease state and the risk involved and what we can do to treat and cure it. Now, as far as autonomy, trust cannot be forced. And that's kind of the main thing about this, of why I don't want to go through check boxes. If you do all these things, X, Y, and Z, then the patient's going to trust you. That's just not how it's going to be. We've got to let the patient choose. We've got to give them alternatives. We want to give them options. If they don't want to get treated right now, we need to respect that. We need to understand that maybe they're not in the right headspace and they want to wait and take care of some other things. They might want to go to drug rehab first. Other social factors might come into play that they want to take care of before they get treated. Others might want to do them all at the same time. So we need to just be flexible and understand we can tell them the risks, but it's still up to them to choose and decide to make that choice. We don't want to force it, because I don't have good outcomes when I'm trying to force things. I see patients every now and then, I feel like they don't want to be there, and I do my best to engage them, tell them the importance of it. But inevitably, they make a choice that they don't want to actually be there, and then they won't follow up. Phone number changes, something like that, and then I'm not able to reconnect with them. So they're kind of overall, there is no guarantee. We want to make sure we're providing all the accurate information we can, and let them ultimately make that choice. We want to put it in their hands. We want to give them all the information, give them a choice, show them the benefits, show them the risk as to why we care so much about treating hepatitis C, and kind of leave it in their hands to go forward. So with that, that concludes our presentation. I can answer any questions we might have about building trust. If anybody wants to open up and kind of tell experiences they've had, I'm more than happy to. We've got 2 patient cases, but we can also talk about experiences you've had in your primary care settings as well.
I was talking and not off mute, and I was trying to tell everyone else to feel free to come off of mute. So do feel free to come off of mute and ask questions or say your comments, or maybe how in your practice you have helped build patient rapport and worked closely with your clients, whether it's using specific techniques or different screening tools, things like that. I know there are lots of different approaches to this, and really each client is unique as well. Taking a little bit different approach too, if you don't want to come off of mute. We do have Minty, which I'm going to attempt to use. I see at least one person has joined because they like it. So if you're able to go to minty.com and put in this code, or on your phone, you can just scan this little QR code, and it should pull this up so that we can kind of interact in that way as well, and hopefully get some feedback from everybody too. And I'll see if I can make it full screen and not mess anything up. I think I did it. I see one more person that's joined. There's a couple more people. Awesome. So I see people joining. I think we have 27 online, so we'll give it just another second for a few more people to jump in. And like I said, come off of mute and feel free to give your experience in your clinics too. Okay, I see people getting added in, so I'll move on to the next slide. You can still join. And if somebody wants to drop the code into the chat, that would be great. Melissa, if you don't mind typing it into the chat, and minty.com, in case we still need people to have it to join. I can't see the chat, so I don't know when it's there, but hopefully it is. Okay, so some responses from you all. What do you find helpful in building trust as you're speaking with clients? Are there specific tools, or being transparent, respectful? Yeah, absolutely. Getting the patient to talk more than you. Yeah, I think that goes back to some of those open-ended questions too. Oh, that's a really good point. Having a neutral tone, and just being kind when speaking. Transparent with personal history and showing empathy and concern for their well-being and health. Definitely. That they have some knowledge about my language and culture while respecting it, even if it clashes with their own. Yeah, that's a really great point. So when we have conversations with people, we encounter all different types of people. And so really important to kind of know our own biases and cultures and how that might be different. But that doesn't mean that we can't support those individuals. speak the truth always. I think that highlights really well what you were talking about, Dr. Allen, where, you really have to try and make sure that they're aware of all of the steps and kind of walking through each thing, even if it's not, even if it's something that they might know, we don't assume anything. We don't know where their background is. So making sure that we're walking through that. Provide medical language and layman's terms. Yeah, absolutely. Descriptive, precise, formulating a manageable plan, reasonable goals. That's a great point. Ask questions with an open ending, so they feel open to talk through those things and going through. Yes. Appropriate medical language that's clear for patients without talking down to them. That's a really great point. I think sometimes it's hard. I don't know. Does anybody else think it's challenging sometimes to be a patient or a client yourself when you're talking to other people? I feel like sometimes, I guess I've heard it both ways. Like some people will go in and be like, well, I'm a nurse, or, I'm a physician, or what have you. And so you come in with your own knowledge and perspective and understanding even of medical things. But then I have found out in my own personal life, sometimes just because I come from a medical background doesn't mean that I know I know what this provider is talking about. And so I've seen some providers come in and want to share that they're a provider too, and other providers come in and I would never have known they were a provider if they hadn't had, a family member hadn't come in and mentioned it, just because I think that we have to remember to talk to everybody kind of the same and be transparent. And like I said, not make assumptions too. It's really easy to be like, oh, they're a medical provider, they know this. And just because you're a medical provider doesn't mean that that's your, forte or something. You're coming there to be treated as a patient too. So even treating other individuals in the same field, I think is really interesting. So actively inviting them to ask questions and engage in discussion, being transparent and listening to the patient, make notes in their chart about certain things. Oh, that's a great idea to talk about when they come in next time. That always makes you feel really welcome. I've had, I think, 1 or 2 providers in my past that have done that. And so I feel like, oh, they remember me, even if they probably don't, but it makes you feel better about it. So that's a great point. I love these ideas. And you all can come off, you can come off and mute and share these too, so you're not just having to listen to my voice. I've heard some people use things like Espert, if anybody's heard of that. It's a screening tool frequently used in substance use disorder programs, but there are other tools too. And sometimes I think that people have said that, they're really effective in building rapport and kind of making you have open-ended questions and get a conversation started. That's also sometimes harder, but also recognizing too that I know providers probably feel like they have limited time. Sometimes there's metrics to be met and things like that. How do you feel like that plays a role in the type of relationships that you're building with patients, and how do you optimize that? And it doesn't have to be this screening tool. You all can put other stuff in there too. I was just curious. Or you can come off of mute. I see a couple people there because they like the question. Has anybody heard of this screening tool? So it is a really great tool. I can attempt to open the chat and stick it in there. Let's see if it'll let me. There we go.
Mia, this is Melissa. Do you care to go over the acronym of Espert? Some may not know what that is.
That's a good point. So it's screening, brief intervention, and referral to treatment. So it's typically done before a person is seen, like I said, often in substance use settings, but it is a screening tool for substance use and kind of mental health and things as well, but a really great tool to get a conversation started. That is a whole presentation in and of itself, honestly, but it is a great tool to build rapport and get to know more, I think, about a patient's history too, which plays a big role in kind of their hepatitis C treatment and other things as well. So I was just curious if anybody had heard about it, or if there's other tools that maybe they use, or motivational interviewing as a technique or a tool that Dr. Allen had touched on today too. So that's an option too. And it's okay if we don't have, it sounds like you all used a lot of tools, maybe just don't have a specific name for them. It's just kind of building rapport. So that's fine too. Any questions about that? I think I was able to put the link in the chat for those that want to hear more about it. Are there any other techniques or things that you have found helpful in building rapport? Do you feel like it changes with certain
Mia.
settings or things like that? Yeah, go ahead.
Hi, I'm sorry, this is Rebecca. I was just wondering, do you think that maybe at the next VH huddle, we could kind of go a little bit more into detail about this tool?
Yeah, we probably can internally, and then if it makes sense, if anybody else is interested in it and want to talk about it during some of the echo sessions too, I'm sure it's something we could bring up then as well. So thanks,
Awesome,
Rebecca.
thank you.
Hey Mia, it's Lindsay.
Yeah.
I'll just come off chat to kind of probe other providers about this. So I personally like certain tools. I think they're unique, but sometimes I feel like they put a lot of pressure on me as a provider in certain situations that I feel like I have to address everything within that tool instead of allowing sort of the patient and my conversation to kind of in combination lead the discussion. Other providers may feel different about that, but like sometimes before I ever reach out to a patient, I will kind of in my mind have an idea of what we need to talk about, but initiate the conversation with like an open-ended question to kind of help prompt the patient to guide the conversation, if that makes sense.
Yeah, that's a really good point, Lindsay. Tools, sometimes you can't be really prescriptive in each setting. It is different with each client, as I'm sure we all have experienced. It is a unique thing. So that's a really great point too. I think the next we will get into